Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. Bear with us one moment. Brief technical difficulty. All right, we are now ready to begin. Welcome to today's update on COVID-19 in Alberta. With us remotely, but with us as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today's update, as Tom said, will once again be done remotely. Although I'm feeling a bit better and I hope to be back to work soon, in keeping with my advice to all Albertans, I'm staying home until I'm feeling well. It can be frustrating to stay home while sick, but it's a crucial part of keeping each other healthy this winter. Before I begin my update today, I want to highlight an important change to my health records that will help parents receive their children's test results more quickly. As you know, we have been working very hard to streamline every facet of the testing process across the province. I know the time it takes to get results is still not as fast as we would like it to be, and work continues to shorten this. In addition, we have heard concerns from parents and guardians about their inability to access their children's results as quickly as possible and to get a written record of negative results. Effective today, all parents and guardians in Alberta can now access COVID-19 results for their children through My Health Records. Once a child is tested, parents will be able to log in and see their children's results as soon as they are available, anytime, day or night. This information is accessible to parents and guardians of any child under the age of 18. As an added feature, parents will also be able to print their children's COVID-19 test results and show them to others if needed. Sign up is free, and all that's required is government-issued ID and your personal health number. Information is available at alberta.ca/myhealthrecords. I encourage all parents to sign up. I recognize there is still more to do, and we will continue to look for ways to reduce testing wait times and meet the demand. Turning to today's update, there are currently 64 people in hospital with COVID-19, including 12 in intensive care. We identified 173 new cases of COVID-19 yesterday, and the provincial lab has completed more than 14,000 tests in the last 24 hours. Currently, Alberta has almost 1,600 active cases. There have been 2 additional deaths since our last update. I have also been informed of an additional death today at the outbreak at the Foothills Medical Centre, which will be included in tomorrow's online numbers. As always, it is essential that we never forget that these deaths are more than numbers. They are people who were loved and whose absence creates a tremendous hole for family and friends, which is true for all those who have died recently, no matter what the cause. Health officials continue to work hard to manage the outbreak of COVID-19 at the Foothills Medical Centre. To date, a total of 35 patients and 29 healthcare workers have tested positive, along with 3 visitors. Contact tracing continues, and the situation is being closely monitored. Enhanced screening measures among patients and unit healthcare workers have been implemented, and the hospital has increased infection prevention and control measures. The investigation into this outbreak and the sources of exposure is still underway. Turning to schools, as of today, 28 schools have come off of alert status with no transmission, and affected students and staff are back in the classroom. There are active alerts or outbreaks in 133 schools, which is about 5% of all schools in the province. There are currently 257 active cases at these schools. There are 52 schools with an outbreak, including 7 which are currently on the watch list, with 5 or more cases. I want to remind everyone that a school outbreak is called with just 2 cases in a school and does not mean the school is unsafe. In fact, only 11 of these schools have had any likely in-school transmission, with most leading to only 1 case. It has already been 1 month since students first started going back to school. More than 101,000 tests have been completed for school-aged Albertans since September 1st, with a positivity rate of less than 1%. I want to thank all the parents, teachers, students, and school staff for their hard work and dedication during these last 4 weeks. You were a big part of why we have kept cases under control and have so far prevented widespread transmission within classes and schools. This is an unprecedented time, and I know that resuming classes has been a difficult transition for many. I know that many parents have questions about whether symptoms such as a runny nose will be removed from the stay-home checklist, or how long entire classes will be required to stay home as close contacts of a single case. We continue to monitor the spread of the virus in school cases and watch the developments in other provinces. As soon as we have enough evidence to update these approaches, we will do so. It is particularly challenging right now, as we are starting to see the impacts of the usual increase in rhinovirus and enterovirus infections that typically happens at this time of year. These two virus families are key players in causing the common cold, and since the middle of August, we have seen a slow and steady rise in numbers of people with an infection caused by viruses in one of these two groups. These infections are almost always mild, but the symptoms are identical to what a mild COVID infection looks like, so it is not possible to tell them apart without testing. That is part of the reason why, despite refocusing our testing on symptomatic Albertans and those in priority asymptomatic groups, we have not seen our test numbers go down. We are entering cold and flu season, and we must all be prepared. To prepare our health system, we shifted our testing approach 2 weeks ago to help support the increase in people with COVID-like symptoms who needed testing. Alberta has also ordered 1.96 million doses of the influenza vaccine this year. That is a record for our province and more than 20% more than last year. Today, I want to highlight the importance of getting your flu shot. As usual, health practitioners will begin outreach to vulnerable populations as soon as they receive the vaccine, no later than October 13th. This work will help ensure that vulnerable Albertans, including those in continuing care facilities, are immunized as quickly as possible. For the rest of us, 6 months and older, Alberta's immunization program begins on Monday, October 19th. Getting immunized this year will look a little different than in the past. As we learn to live with COVID-19, we are adapting influenza service delivery to reduce transmission of the novel coronavirus. We will be encouraging all Albertans aged 5 and over to get immunized free of charge at any participating pharmacy or through their physician's office. Immunization at public health clinics will be only by appointment and focused on delivering vaccines to children younger than 5 and their parents or other household members, to individuals who don't have a provincial healthcare number, and to those who live in a community where there are no other immunizing healthcare providers. As well, for the first time, Alberta will be offering a high-dose influenza vaccine for residents of provincially funded long-term care beds who are 65 and older. I know that some may wonder if getting a flu shot will put them at risk of COVID exposure. All pharmacies and doctors' offices will also have booking processes and other measures in place to ensure that physical distancing and other health measures keep you safe while you are being immunized. While the program does not start for another few weeks, I am speaking about this now because it is important. I am strongly urging all Albertans, especially seniors and those who are high risk, to get immunized when this program starts later this month. Do it for yourself and do it for those around you. When you get immunized, you protect not just your own health, but the health of your loved ones, as well as more vulnerable seniors, young children, and those with chronic health conditions. By keeping the number of influenza cases low, you will also help our health system focus on the COVID response. Finally, I'd like to end today by answering something I have heard many questions about: Halloween. I know Halloween is a favorite day for many, and I know many parents are already planning their children's costumes and activities. I have no plans to suggest that Alberta cancel Halloween this year. My own children would never forgive me. In many ways, Halloween is actually safer to celebrate than other holidays. Unlike Thanksgiving, for example, where families traditionally gather inside to enjoy dinner together, most of Halloween's activities take place outdoors and largely within one family. However, we do need to make it as safe as possible to celebrate this year. That is why we have created a page with tips and advice on how you and your family can enjoy a Halloween that is still fun and scary, but for the right reasons. You'll find it at alberta.ca/Halloween. We've also created posters you can print and put in your window or on your door to let trick-or-treaters know if you're handing out candy this year or not. If you choose to hand out treats, or if you have children trick-or-treating, please review the tip sheet in detail. However, let me summarize a few key points right now. First, please avoid hosting group get-togethers or Halloween parties. Instead, trick-or-treating should be done within your own cohort or family and staying within your community, and avoiding contact with common touch points like doorbells or hand railings. Dressing up and trick-or-treating is the best part of Halloween for many children, and this can be done safely by choosing costumes that allow children to wear a non-medical mask. Like elsewhere in public, try to minimize your contact with others and maintain 2-meter physical distancing whenever possible. If you're handing out candy, wear a mask. And if the weather is warm enough, consider handing out treats outside on your driveway or front lawn. Try to get creative and have fun with the ways to minimize the risk of exposure that comes when giving out candy, like the candy slide I mentioned earlier this week. And please use prepackaged candy, not homemade treats. As always, the safest way to ensure we have a safe Thanksgiving, Halloween, and school year is to limit community transmission. I wrote an op-ed earlier this week stating that the future is in our hands, and this remains true. We are all in this together. If we all do our part and stay vigilant, we can keep each other safe and limit the need for any future restrictions that could impact other elements of our health. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
Thank you very much. The first question is from Robson Fletcher of CBC News.
Hi there. Thanks for taking my question, Dr. Hinshaw. I just wanted to ask you a bit more about the school situation. So last week at this time, you had noted that the number of daily cases among school-age students had been on the decline. In the past week, it looks like those numbers are starting to creep back up again. But at the same time, it looks like the number of tests has really shot up a lot as well. So I'm wondering what you make of these numbers. And I was also wondering, when it comes to the school outbreaks and watch lists, sort of how long it takes from a student getting a positive test or several students getting a positive test to a school showing up on that list.
So the first question about the trends, you're right that this last week the numbers have gone up a little bit, although again we still haven't hit the peak of total cases in that school-age group that we saw in April. And as you note, the number of tests is significantly higher. So I believe last week we tested over 24,000 school-age children. And the positivity rate for that school-age population in April, when we saw our peak, we were sitting at around a peak positivity rate of about 8 or 9% of all people, of all those children who were tested, about 8 or 9% in April were coming back with a positive. And right now in the last week, we're sitting at below 1%. So again, we are finding again, that trend that you report of increased number of cases comes along with a massive increase in the number of children who are getting tested. And that's likely, again, due to the fact that we have other respiratory viruses circulating in our community. And so the vast majority of children who go for a test, greater than 99%, in fact, do not have COVID-19. So both of those facts together, again, indicate that we have not seen a massive increase in cases. In fact, again, we did see a slight decline in the first few weeks, with, again, a little bit of a rise in this most recent week, but nothing to suggest that school is driving those cases. With respect to the time it takes between a single or several cases being identified and when a school is on the watch list, that depends in part on the speed of the investigation. And as I mentioned, Alberta Health Services has been working over the past several months to build up their contact tracing capacity, and they continue to do so. And so it does depend a little bit on the situation, but what happens is when a positive case is identified, Alberta Health Services contact tracers call that individual. If it's a school-aged child, they of course call the parents and find out what the circumstances are. And just because there's a case in a school-aged child, of course, doesn't necessarily mean that there was an exposure in a school. So that information needs to be obtained from that interview. And then as soon as the AHS contact tracers identify that there was an exposure, they're in touch with school administration. And it's at that point that there's an arrangement to have a memo sent out to schools. And so the reporting that we do is based on the information that's available as of the beginning of the day. So the numbers that I reported are all of those schools where all of that process had happened and been reported through our systems by 8 o'clock this evening.
Operator, can you put through the next caller, please?
Thank you very much. The next question is from Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. In August, it was announced that Alberta would switch over to the federal COVID tracing app. Why do Albertans still not have access to the app, and how important is a tracing app in curbing the spread?
We know that a tracing app is one additional piece of the puzzle, and we want to make sure Albertans have access to as many ways of preventing spread as possible. As you know, we do have the AB Trace Together app, which is still in use. And the federal app is something that we are looking to transition to, but there are still some details that are being discussed. And so we don't have a timeline on that at this time. Those details are still in discussion. But again, Albertans are still able to use the AB Trace Together app, and that is available for download.
Operator, can you put through the next caller, please?
Next question is from Julia Wong, Global News.
Hi, Dr. Hinshaw, and perhaps I may have missed it. I'm just curious how many schools in the province where there has likely been in-school transmission. And then my question for you today is the weather is starting to get a little bit colder, and dining will likely have to move indoors for months when the snow arrives and temperatures drop. We've heard a lot about how indoor transmission is more likely than outdoor transmission. So will any rules have to be adjusted when it comes to restaurants and indoor dining during the winter months?
Thank you for those questions. First of all, there are 11 schools that have been deemed to have at least one case likely acquired in that school setting. And of those 9 schools, 9 of those 11, there's only a single case that was attributed to likely in-school transmission. Again, that's noting that it can sometimes be difficult to determine where a case was acquired, but again, that's a fairly low number when you consider all the schools that have had cases. The question about indoor dining, we have restaurant guidance right now that is appropriate to mitigate the risk of being indoors. We do recommend that servers wear masks, of course, because it's difficult to maintain that 2 meters of distance at all times. And I know restaurants have been looking for ways to increase the number of people in the area while doing so safely. And so, for example, I've heard of many restaurants putting up plexiglass shields so that different tables are separated from each other by a partition to reduce the chance that there could be any spread of infection. And so again, our guidance documents do give restaurant owners and operators several options for considering how they can provide diners with that safe dining opportunity, because we do know that being outside does limit the risk. And of course, as you say, with the weather getting colder, more activities will need to move inside.
Operator, can you put through the next question, please?
Thank you. The next question is from Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. On Monday, when you were asked why Foothills has not closed in the way that the Misericordia Hospital had, you had said it was your understanding that there's a fairly clear linkage between the majority, if not all, of the cases that have been identified. Can you explain what those, I understand that this is still under investigation, but can you explain what the train of transmission is and what the theory is on how it got into Foothills Hospital?
So as to the how it got into the hospital in the first place, that is something I don't believe has been ascertained at this point in time. And again, the Alberta Health Services would have more details on the connections, but what has been reported to me is that, again, the vast majority of cases are able to be connected back to those units where it seems that exposure did take place. So at this point in time, again, what's been reported to me is that there is that connection between the cases. But of course, AHS would have more details as this investigation goes forward about how those connections have been made. And as I'm sure they have mentioned, sometimes that can take some time to work out all the details. But what has been conveyed to me is, again, that there doesn't appear by the linkages between the cases to be widespread transmission in the hospital. It does seem to be limited to those units where outbreak measures have been put in place.
Operator, can you put through the next question, please?
Yes, thank you. The next question is from Jeff Slack, 660 News.
Hi, Dr. Hinshaw. Thanks for taking my question. A survey by the Health Quality Council of Alberta showed that the pandemic is causing people to put off seeking health care just because of anxiety and stress. What do you think can be done to restore confidence in the healthcare system, especially when people see outbreaks like the one at the Foothills Hospital?
It's an important question, and we know from the results of that HQCA survey that people are reporting higher levels of anxiety and distress. I will note that the survey was undertaken several months ago, so it will be interesting to see the results of the next survey that they're undertaking, as it's possible that those opinions may have shifted over the past several months as we've been able to open up more activities. But what I would recommend for those who are considering whether or not to seek healthcare is to look at the fact that while we have had a couple of significant hospital outbreaks, and of course those are a concern, in the vast majority of healthcare interactions, both in primary care clinics, in hospitals, and in other healthcare settings, we have not had any reported issues. And so while there are these two clear exceptions with the Misericordia and the Foothills outbreak, in the vast majority of other places, people who have COVID have been cared for safely. There has been no transmission. And so I would really advocate for people who are considering what kind of healthcare they need for any cause. First of all, to consider all the options available to them. There are options like virtual healthcare that are more available now than they were before. But also to remember that the vast majority of healthcare interactions over the past 7 months have been done very safely and with no risk to the healthcare provider or the individual seeking care.
All right, we have time for 3 more questions. Operator, could you put through the next one, please?
Yes, the next question is from Jesse Wisner, Global TV Calgary.
Hi, Dr. Hinshaw. Thanks for taking my question. We've heard concerns about fatigue and burnout from healthcare workers now having to pick up extra shifts and overtime due to staffing shortages from the Foothills outbreaks. Unions say Foothills was short-staffed before the pandemic, and workers can't continue at this pace. What's the province's plan, and could more staff be hired, or how will this burnout be eased? Thank you.
I sympathize with all frontline workers, whether healthcare workers or otherwise, who are dealing with an outbreak in the location that they work. It does put additional pressure on. I think some of those operational details, though, about staffing and staff management would be best directed to Alberta Health Services, as they would have those details. What I will say is that I certainly want to emphasize how much I appreciate all of the work that goes into responding to this outbreak and the tremendous effort that is underway right now to ensuring that there is no onward spread at the Foothills and in other healthcare settings across the province, to making sure that the everyday precautions are in place to prevent spread.
All right, Operator, could you put through the next question, please?
The next question is from Terry Reith, CBC.
Yes, hi, good afternoon, and thank you for taking my call, Dr. Hinshaw. The federal government is listing 290 cases, COVID cases, on First Nations reserves in Alberta. I don't see any active outbreaks. Could you please shed some light on where these cases are occurring and some of the circumstances that you're seeing?
I will note that number, to the best of my knowledge, would not be active cases. That could possibly be total cases that have ever been diagnosed. There is a report on First Nations cases that our epidemiology team works with the Alberta First Nations Information Governance Centre on, and so that is available publicly. We can get you the link to that. But what I do want to say is that First Nations leadership across this province has done a tremendous job of protecting their communities, protecting their population, and that continues. They're working very hard when there are individual cases that are identified to prevent further onward spread. And when small clusters appear, again, there's a great deal of work that goes into making sure that there isn't widespread community transmission. And that's supported by the First Nations Inuit Health Branch, as well as Alberta Health Services at the local level. So I just want to underline how critical that work has been and how much I appreciate the leadership and efforts of the First Nations communities in that regard.
All right, operator, could you put through the final question, please?
Dylan Short, Edmonton Journal.
Hi, Dr. Hinshaw. I was just curious, in the past, we know that Albertans have not gotten the flu shot at as high rates as other provinces in the country. I was wondering if there's any indication at this time of how the rates of getting flu shots will be affected by the pandemic.
It's difficult to say. We know from other countries around the world that had their influenza season earlier, so Australia being the dominant example, that they saw a significantly increased demand for influenza vaccine over what they typically see. And we wanted to make sure we were prepared for that. I don't have a prediction as to the proportion of Albertans who will choose to take up the influenza vaccine, but I certainly want to encourage Albertans to do so, not for themselves alone, but also for those around them. And we will make it as easy as possible for Albertans to get their vaccination this year. And we'll continue to provide information around the vaccine, how to get it, and again, all the reasons why it's a helpful thing to do, not just because of protecting from influenza, but also because at this time we want to make sure that we're minimizing severe respiratory illness from any cause so that our system capacity is maintained to deal with COVID-19, again, as well as the odd sporadic influenza infection. But as much as we can do to minimize that, would be ideal.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a good day.